Hi, my name is. so, oh yeah, so sorry. Yeah, my name is Yasu, and I'm from Japan. And in my channel, I do Hitorigoto. So Hitorigoto is a Japanese word. It means talking to myself because I am talking to the camera to talk about what is going on in my life. And then it's been a while that I covered this topic, which is the I don't know the English term. In Japanese, it's called jikasenshuyo. So it's a parotid gland tumor. So exactly almost 2 years ago, I found a little lump here. Lump, lump. There was something when I touched it. I could feel there was something in here. And I went to a dermatologist, and then my doctor says that it's really in the uh, parotid gland. You have to go to see other specialist, which I did, and then it ended up that I was having this super tumor in here. They did a biopsy, and then they found a few tumors here. The first biopsy indicated that some of the tumors are not cancers yet, but the others are unknown. And the only option is just do the surgery to remove it because it can only get bigger and bigger and eventually become a cancer. So I underwent surgery the end of March 2023, and then it's been almost 2 years since then. Um, right after the surgery, of course, this part of my body is really messed up. My face is really numb. I couldn't really move it, and then the scar was horrible, very scary. I couldn't really chew that well, but human body is a amazing thing that it just simply got better and better. And until recently, I have told people, and then in the videos that I think I talked about that I don't really suffer from any how it's say. See, this is bad. My vocabulary is really. I'm losing the English vocabulary. So yeah, After Effects, like I didn't really suffer from any. I think I mentioned that I didn't really suffer from any after effects of the surgery, but looking up this year, especially last month, uh, I had a lot of issues with my ear, like a lot of infections. Um, in English, it should be called paranasal inflammation, and I had to take an antibiotic, and then I'm still taking some other medications because it really didn't go away. And then like they checked the pressures of both of my ears, and then the right ear it has a lower pressures and a little bit like different charts and everything. And it hit me because in my entire life I never ever gone to the otolaryngology. I'm not sure if I pronounce it correctly. Otolaryngology. But yeah, the doctor who specializes in nose and in ears. I didn't see the doctor that often. This as much as this year, and I don't really suffer from conditions based on my nose and then ears until this year. Last year, it didn't really happen because I really didn't go out because I had to really focus on my recoveries and everything. But this year, I've been really a little bit more active, and then I caught something, but infection really happening, and it hit me that maybe after the surgery, my nose and my right ear becomes a little bit vulnerable to those infections and everything, because I'm forced by my doctors to do the weightlifting, especially my lower body, so that it could help my body to restore the, like, pushes to produce the testosterone, which I tried to comply with it, but like a few times when I put so much pressure, like my ear got popped and I had to go to see a doctor, and then the imbalance in terms of the pressure in both my ears are caused by that. I had to stop doing the weightlifting, which I feel relief because I hate doing the weightlifting. But looking back, I really went to see that doctor so often. So this could be because of the surgery to remove the damn, I am bad. Parotid gland tumors. But I'm not sure, because the difference between now and before is, it's right now is after COVID, before is before COVID. What I meant is that people didn't go out in that 3 years, and then our body becomes more vulnerable to a lot of infections and everything. And that is why I see so many news that a lot of pandemics, like flu pandemics and everything, is really happening in Japan. Easy to get sick. But also, I might be biased, so I am consumed by the news. So I feel like that kind of things are really happening. I'm not sure. But also, like, I am 2 years older compared to the time that I was getting the infection, the surgery, or compared to the time before I got the surgery. So my body is getting older and older. So of course, as I get older, the more easily I can get sickness and everything. So it's just a part of the aging process. That could be it. But this is something that I am going through. It makes me a little bit cautious about, or concerned, because if I am mainly dealing with both my ears and the nose, then I might not be concerned. I am kind of accepting that it's just my aging process, all because I didn't go out for like nearly 3 or 4 years. So now I'm a little bit more active. I get sick easily because my immune system is trying to catch up with it. But particularly my right ear, which is the side that I did the surgery on, those parts are mainly affected by inflammations and everything this year. So this, it could be due to, or partially due to, the surgery to remove the parotid gland tumors. But nobody can really tell. But I'm not here to scare people, because I've seen some comments in my previous videos about parotid gland tumor surgery, and I don't want to scare people. I really want people to get consultation with their doctors and decide whether they want to undergo the surgery or not on their own. But as part of my story, who actually went through the surgery and then experiencing a little bit unusual conditions compared to before surgery, this is my story. So yeah. And as always, don't, I'm not saying don't get sick, but please take care of yourself. Look after your health, because health is really the most important thing, really the foundation of everything. Because without good health, nobody can do anything. And there's so many things that we have to look after, we have to deal with in our lives. And now, on top of everything, if health issues come and occur and we have to deal with it, it's just too much to handle. And I don't really want you to go through the same thing. So please don't push yourself. So for now, that's all. じゃあね。Bye. Bye.